Good afternoon, and thank you for attending. This is Josh Drayton, Communication and Outreach Director for the California Cannabis Industry Association. This is our COVID-19 webinar series. This is the third that we are doing our best to keep you up to date with real-time information, understanding how to keep your business compliant during COVID-19, and bringing professionals to give you the best advice possible on what you need to know in dealing with this current pandemic that we've never dealt with before. First, I would like to thank Governor Newsom and the administration for ensuring that cannabis businesses are considered essential during this time. This has given us a lot of room right now to elevate our businesses, to prioritize public safety and public health, to tend to our workers, our customers, and make sure we're able to deliver essential services during this time. I would like to remind everyone that we are doing a series of webinars, this being the third in the series. The first was from our Risk Management Committee. The second was Jessica Velazquez of Indiva Advisors giving tax information during this time. The one you will be reviewing today is Behind the Data, how essential businesses are adapting. I'd like to remind everyone that the cannabis industry is incredibly adaptable. That is one of the strengths that we have, and we are working to bring you all the professionals to deliver best practices during this time period. This webinar will be up on our website tomorrow. It takes about 24 hours, but all the webinars that we are doing are on our website. We also have a COVID-19 resource page. So do please pay attention to those resources, as well as all of the emails you get from CCIA. We are being very conscious that you're being inundated with a lot of information right now and are trying to bring you the most relevant and helpful for your business and for your customers. So with that being said, I'd like to turn this webinar over to your panelists, Jocelyn Sheltra of Headset, Chris Violas of Blaze, and CCIA's board president, Conrad Gregory of Harborside.
Thank you, Josh. Hello, friends. We really put this webinar together because both Conrad, Chris, and I all felt that we could provide different perspectives in terms of what we're understanding in the industry and what we're learning in real time around the COVID-19 trends. And so what I first want to do is do a quick round of introductions, and then we're going to talk about what we think we can provide to you all. And this is meant to be a collaborative session. So if you have any questions, please just put them in the chat box, and then we will do our best to answer them. So my name is Jocelyn. I am the Director of Strategy at Headset. And what that really means is that I spend my time working across all sides of the supply chain in California. I spend a lot of time working with associations. And over the past month, since we've been in COVID, I've really been working more closely with, city council and trying to educate everyone on all of this real-time data that we're seeing. So in terms of what I'm going to be able to provide here, we're going to be looking at some of the trends that Headset is seeing in terms of sales and consumer trends. And then we have a bunch of questions that we're going to be able to lean on Conrad and Chris and get their experience and what Conrad is seeing from Harborside, also being CCIA's board president, and then also Chris Violas, who is the founder and CEO of Blaze. So they've been seeing a lot of incredible things in terms of the transition into delivery. But Conrad and Chris, if you wouldn't mind just introducing yourself briefly and saying a few quick words.
Yeah. Take it away, Chris.
Sure. First off, thanks, Jocelyn. Thanks, CCIA, for having me. As Jocelyn mentioned, my name is Chris, CEO of Blaze. I'm very fortunate I get to work with operators across the supply chain day in and day out at Blaze. We provide software for all the operators with the exception of laboratories. So I've seen firsthand a lot of what's happening at the retail perspective, also at the distribution level as well in terms of the supply chain. So excited to bring some insights to everyone on this call today.
Great. And hi, everybody. I'm Conrad Gregory. I run government relations work out of Harborside, as well as the political work there. And I'm also currently the president of the board of CCIA. And in that capacity, I have done a lot of political work, including previously working for Lieutenant Governor Gavin Newsom back when he was doing his Blue Ribbon Commission on marijuana policy. And so I've had quite a lot of experience at the local level and at the state level in terms of both policy and politics, as well as helping guide, Harborside during this very crazy time. And I do want to just thank everybody for being able to jump onto this webinar. And I look forward to talking with all of you.
Great. Thank you, Conrad and Chris. Okay, so today what we're going to cover, so I'm going to go through some sales and consumer trends that we're seeing at Headset. Like I said, Chris is going to talk about some of the shifts into e-commerce. Conrad's going to provide his perspective on operational and compliance protocols to navigate through this time, and then we'll leave y'all with some resources. So before we jump into this, I just want to explain quickly about the data and how it's collected, because this is really important as we're thinking about looking at different data points in the industry. We really want to understand how the data is collected. And so for those unfamiliar, Headset is a data and analytics company servicing the industry through 3 different platforms. Our retailer platform, our bridge platform, and then our insights platform. And so all of the data that I'm going to be going through today is going to be directly connected via our point of sale system. So we're pulling all of this data in real time. We go through various processes to cleanse the data, methodologies to make sure that the data is reflective of the entire state of California, as well as all of the markets that Headset reports on. So just remember this data. Recreational sales data is what we're looking at, and this is all collected in real time. So just to give us a baseline here, this is what the market has looked like in terms of adult use cannabis sales in 2019. So California, as we can see, it really is the largest market. When we're looking, it's almost as large as, it's bigger than all of these other markets combined. And so for us, I think it's really important that we're really taking a look at what's happening in real time and understanding these trends. So let's just give this baseline here. In the last year, in 2019, California saw about $2.8 billion in sales for the recreational market. So life in 2020 for us has been very predictable in terms of cannabis trends. The cannabis industry, much like other consumer packaged goods industries, beverage industries, we have started to see trends that are mirroring what we would see in those traditional industries. So we see these spikes in sales that happen at the end of every month, most likely, people getting their paychecks, then making these purchases. But when COVID happened, we started to see that these trends were not in line, and they're all over the place. This has made it very hard for our analysts because we are trying to keep track of all these trends in real time. And as you can see here, it just kind of goes all over the place. And so this, as an industry, makes it very hard for us. And so what we want to do here is shed some light on what is actually happening since coronavirus. So what we're looking at here is a closer view of March. So we're looking at March 1st through March 22nd. And really, we're starting to see around March 13th is when, the sales start to spike. The line in black is the expectation line. So anything that's above this line is exceeding what we would have normally expected to be happening for this time of year in cannabis. And anything below is going to be a decrease in sales of what we normally would have expected. So immediately what we can see here is in Nevada, we see this is an outlier, right? We see that there is a dip in sales. I want to note on this that in Nevada and Clark County makes up 80% of Nevada sales, and Las Vegas is in Clark County. So what we see here is this direct correlation to people not being able to travel in these highly tourist markets, seeing declines in sales, where we see these spikes in sales from March 13th to the 20th, when we started to see some of these shelter-in-place orders go into effect. So as we're looking at this, I wanted to see from you, Conrad, because you've been so involved in the industry for many years from the policy side. In your perspective, retailers, we're seeing them very concerned about these policy changes. We saw Berkeley go into a reversal, fortunately, over an 8-hour period where they were removing any storefronts from being able to operate and moving to just a delivery business. Santa Clara County is still currently in this. I know that they were voting on this yesterday, and I don't know that there had been any decision made. But can you talk about how some of these impacts on the local level and what retailers are thinking about in order to adapt to these changes?
Yeah, absolutely. You know, here in the Bay Area, all the counties kind of surrounding San Francisco were the first in the country, frankly, to do a shelter-in-place order. So the industry here immediately scrambled to understand what the shelter-in-order place meant for their businesses, and also to make sure that cannabis companies could still stay open and provide essential medicine to our customers. And so we were largely successful in most of the Bay Area companies. And immediately after the Bay Area did its shelter in place, the state followed up with a statewide emergency shelter in place order, stay at home order. And that was when, you know, CCIA was engaged at the state level in getting cannabis deemed essential as an essential business in that stay at home order from the administration. And, you know, I know that things are wild and changing rapidly every day. It's good to take a moment and recognize that as a watershed moment in the history of cannabis, in that our industry was deemed essential by the state of California and is allowed to remain open, which is fantastic. And that was a very important moment for all of us. And I think what's important to keep in mind is that keeping that essential designation is almost entirely dependent on engaging at the local level and making sure that at your individual facilities and your retail operations and all of your operations, that you are strictly adhering to all of the social distancing requirements and any of the recommendations that come down that allow you to remain open, but to protect the health and safety of workers and vendors and employees. And you know, as you pointed out, Jocelyn, we had a little back and forth with the city of Berkeley. We actually had some back and forth with the city of San Francisco in terms of how they were interpreting the shelter-in-place orders. And we're continuing our conversation with the county of Santa Clara. Unfortunately, it's been an uphill battle for them to understand that there really isn't a difference at this point since 2018 between medical and adult use sales, right? Most folks that are doing adult use sales at one time had a doctor's recommendation. They simply haven't renewed that recommendation. So it's been an uphill battle in Santa Clara. There really hasn't been a result yet from the supervisors meeting yesterday, but the pressure on Santa Clara has increased in terms of we have city councils weighing in, state assembly members, state senate members. So it's been significant and it's an ongoing conversation. So we're still very hopeful that Santa Clara will understand the impact they're having on the ability of folks to get essential medicine right now. But just to reiterate, and we honestly can't say this enough as an industry, and you can't say it enough as a business in terms of what you're doing to adhere to social distancing requirements to keep folks safe. At the retail level, at Harborside, you know, we have stickers on the floor that are 6 feet apart to keep people properly spaced when they're standing in line. We have hand sanitizing stations both at the very entrance to the store, so folks have a chance to clean their hands before they enter, and throughout the store as well. We are constantly wiping down frequently touched surfaces, and we've installed cashier shields. It's like a plexiglass shield in front of each cashier station. So that protects our workers and protects our customers during that interaction as well. We have also gotten relief from some of the BCC regulations that prevent curbside pickup. So we are now doing curbside pickup, and also gotten relief from some of the regulations that require, for instance, a signature on a receipt for delivery. Right, so that helps reduce the amount of contact between staff and customers, protecting folks. And you can't reiterate this enough. And it's clear at this point that the shelter-in-place orders are going to be in place for quite some time. And so, as anything in life, people get used to things, they start to relax, they think it's getting better, and then they get lax. And that's when you need to keep reminding folks that the shelter-in-place orders, social distancing, and sanitation, those are all key to both literally stopping the spread of this virus and keeping our businesses open. So it's really important that we all do that. And I will probably say that many more times on this webinar because we have to remind folks. But yeah.
Yeah, I think that's so important too. And the other thing that I would like to add to that, Conrad, is if you are a retailer and you're following these protocols, I think it's also important that as some of these municipalities are looking at potentially reversing some policy or making some change to curbside or delivery, what I'm noticing in working or going to a lot of these city council meetings, it really tends to be the same group of cannabis activists that show up and are vocal about it. So I also would like to encourage everyone, if you are following all these protocols, and you have to speak up and you have to be vocal within these city council meetings, because our lawmakers and politicians, they're not from the cannabis industry, so they don't know what they don't know. So it's our responsibility to be involved and to be vocal and to explain to them how you're following these protocols, so that these medical patients, where they're in a county like Santa Clara County, where it's said that 95% of people there don't have a medical license, you have to speak up and you have to let them know what the protocols are that you're following, so that they're confident that those patients that are at most risk are going to be protected.
Yeah.
So Chris,
I would just add real quick, Jocelyn, you're absolutely right. You have to engage now politically. If you haven't done it before, it's about relationships. It's about being a good neighbor. It's about being a good member in the community. And you need to have those relationships with your local electeds and your regulators. So if you don't have those relationships, get them now. If you do have those relationships, open up the lines of communication and make sure that you're talking. Yeah.
So on this front, I'm curious to hear from you, Chris. So when we did see, this 8-hour period or so that Berkeley was potentially looking at this reversal, or did this reversal where they were moving to this delivery only model, I saw that a lot of retailers were not prepared for delivery. They hadn't had it set up. So can you explain what the process is for a retailer that does not yet support delivery? How long does it take for them to get set up? What are the things that they need to think about so that they can be prepared should their city go into this type of reversal?
Yeah, absolutely. And a lot of things go into that. Really, it comes down to your local municipality. So first and foremost, check with your local regulations, see if they do support it. Typically, if you take Long Beach for an example, when you went to go to apply for your retail license, in that application, there's actually a section for delivery to tell the city, hey, I intend to do delivery, and maybe put in there kind of any kind of small P package that you may have been asked for. So some cities actually put that in as part of the retail application. So assuming that has been done, assuming you do have your local regulations approval to do delivery, there's a lot of infrastructure that needs to get put in place and quickly, right? From the SOPs and driving SOPs in terms of actually running that delivery and operationally. You have insurance you need to worry about. You have to protect your drivers. You need to decide, what vehicles you're going to be looking at. If you're going to supply those vehicles, whether it be through purchasing them or leasing them, that's obviously the best route to go through, but in terms of liability, but that takes time as well. So we're seeing some stores being able to turn on delivery in a matter of a week or a couple of days. That said, there's a lot of pieces behind the scenes, and as you can imagine, a lot of fire drills going on just to make sure all the dots are dotted, all the T's are crossed. So those are just a few of the hurdles you need to think about. Conrad spoke to that contact list delivery, and that's really getting relief from the state saying, hey, we don't need to capture a signature because we want to protect our drivers right at the time of delivery. So there's some other things that are involved there, but those are relatively smaller and easier to get around. The biggest thing really is making sure from an insurance standpoint, from a vehicle standpoint, from an actual operating standpoint, you have all the procedures in place and that you've clearly communicated those to your drivers, to your folks that are actually operating those.
Great. Okay, so the next thing I wanted to pull in, so looking a little bit closer at the March sales and how they've been affected, a big question that we've been getting is, we saw across the board in many of these states that as soon as the shelter-in-place order had gone into effect, that there was this spike in sales. And then a big question was, okay, well, what happens thereafter? And then how did this look like compared to last year per se? And so this was an article that MJ Biz put out this week, and this is some headset data that was pulled in. And so what this is looking at is, or what I want to call out here is, the recreational cannabis sales in Colorado and Nevada declined from March 2019 to March 2020. And this was the first time for these states that monthly adult use sales had seen a decrease. Now, here in California, as well as in Washington, we still saw that our numbers had rose from what we saw in March of 2019 to March of 2020. But the difference here is the differential in how much these markets had grown. So for example, from March 1st to the 15th in adult use cannabis sales, it was up across the board. But in California, we saw that sales were increased by 70%. Now, when we're looking at this year from March 16th to the 31st, what we saw is that sales were only up 53%. So what this means is that we should be growing as an industry in California. They should be growing more than it was growing at the growth rate of last year, right? But so the differential from 70% of last year to this 53% of this year is really giving us a good peek in terms of what's happening or how much COVID is affecting our sales as an industry overall. And so, Chris, I was wondering from you, you know, as we've seen the changes in sales from delivery to storefront, can you give some insight into what you're seeing from the delivery side?
Yeah, absolutely. So obviously, when we talk about delivery, there's we need to define what we're actually talking about here. So there's some folks that have a non-storefront retail license today. We track those in Blaze very detailed. We understand what's delivery, what's not, and then we have another cohort where they're a storefront retailer that's decided to add on that delivery as a new part of that business. But when we look at just delivery by itself in general, I mean, we're seeing sales are up about 67% just on these non-storefront retail licenses. It's pretty big growth right now going on. I think a lot of that's coming down to potentially the average cart size. We've seen that increase about 11% from February to March. So those that are engaging in delivery, they're just buying more, right? And we're seeing that trend across a few other, you know, whether it be e-commerce or pickup in store. So that's been happening. That's been fairly interesting. From storefronts that haven't done delivery in the past, from our perspective, we've seen a majority of our storefronts light up delivery here and make sure that's getting online. And they're seeing some really good responses to that. We're seeing some folks that had delivery up and running before this COVID took place and also had the storefront. We've seen sales almost 133% jump on that delivery business. People are understanding that there's another delivery mechanism to get their cannabis, and they're using that. So overall, super positive across the board when it comes down to delivery. We're seeing some other interesting things around products and category selection, but something we can maybe talk on a little bit later in the call.
And Conrad, what about from Harborside's perspective? Harborside has 3 stores throughout California, and I find it really interesting that, you know, the Coachella Valley store, in which you have drive-through there, the Santa Clara store, and then the Oakland store. Can you talk about what you're seeing in terms of in-store traffic versus delivery?
Yeah, you know, very similar to what Chris was just saying, you know, our in-store sale traffic has definitely decreased. So less folks are coming into the store. You know, what's interesting though is that you touched on this a little bit earlier, Jocelyn, is that there was a kind of a regular pattern, certainly for sales and in-store sales, which is that Thursday through Saturday would be this ramp up every week as people purchased cannabis going into the weekend. And at this point, what we're seeing and what we're assuming will continue to be the case is that weekends are gone. And what's happened instead is those same sales have been distributed across the normal week, because as I'm sure you're experiencing, just like I'm experiencing, there's no difference between Saturday and Tuesday and Monday and Friday. I mean, what's the difference between a day anymore? We're all at home. And so the same thing is happening for our customers, which is that they shop when they need to shop. They generally are coming to the store less, but in each visit purchasing more. So it's more of a stock up kind of purchasing mentality, not the panic buying, which we saw a little bit ago. That certainly is gone, but average basket size is up and store visits are down, and that seems quite clear. And then the increase for weekend purchases has been distributed throughout the week in general. So what we've got instead is this kind of just unknown shopping pattern, right? We don't really know where new normal is going to be anymore. And then, yes, delivery, big increase in the demand for delivery, and for everywhere we're offering curbside, big increase in demand for curbside. Our store down in the Coachella Valley is unique in that it has a drive-through. And so obviously the drive-through has become very popular. And so we're seeing lots of drive-through traffic. Yeah.
Mhm. Yeah. Okay, great. The next thing I really wanted to focus on that I've been getting a lot of questions around is product preference, and has it changed at all? So when we started looking at some of these data points or the sales numbers, what we're looking at here is a comparison of February 19th of 2020 versus March 18th of 2020. And these are both Wednesdays. So this Wednesday and February 19th is pre-COVID, and 3/18 is in the midst of COVID. So again, both Wednesdays for a comparison data point. And what we're seeing is that we've seen an increase in edibles and beverages and a decrease in pre-rolls. So most likely here, the assumption is, products that you're going to have less hand-to-face coordination, obviously products that you don't have to be sharing as much. But what are both of you guys seeing in terms of a perspective of any shift in product preference? Chris, maybe I could start with you.
Certainly. Yeah, I'll go ahead and jump in here. So I want to take a lens on this, just looking at this through delivery, right? So hear me out for a second. I went in and I pulled the last quarter, so January through March, about a week ago or so. And I looked at what the change of those specific deliveries, what was the mix in terms of product category selection? Do we see any big movements? And what we saw was pretty interesting. It aligns to what you're talking about here, Jocelyn. So I'm reading off some notes here, but if you look at edibles from February to March, up 80% for delivery specifically. So edibles, obviously easy to consume. I would argue here that there's not a scent as well. So people typically don't like that smell around their house for the most part if they have others at home. Additionally, tinctures up 62%. So that's a pretty interesting one for me. I don't see that spike up as much. It's a pretty consistent basis. And then flowers are up about 40% on delivery. So those were the top three movers that we saw. But really interesting to look at the data through just kind of the eyes of delivery, because I haven't really done that analysis before with you.
Mm-hmm.
Yeah.
Conrad, anything notable from Harborside?
Yeah, I can just add, the speculation right now as to the cause of anything that we're seeing in the data is kind of tricky for us as we look at it. So, yes, we've seen a shift in edibles, and we've seen other shifts as well. It's hard to know exactly what's causing it though, because on the one hand, the behaviors are what are changing, right? And so there's a couple of key behaviors that we're keeping in mind, which is one, people are purchasing in more of a stock up basis, right? They're purchasing as if it's like groceries, right? You're trying to go to the grocery store less, and so when you go, you buy more things. And so that's one behavior. The other behavior is you're home all day, and so is your entire family. And so to Chris's point, there's this idea that folks are having to be a little more discreet when they're at home. So how's that changing their purchasing behavior? In addition, because they're kind of buying more each time in order to make less trips, we think that also lends itself toward the increased purchase of edibles, which the edibles can generally hang out longer, in your cupboard, as opposed to other things which you might want to consume right away. So that's, it's not sure yet what the mechanisms are behind the changes in the data yet.
Mm-hmm. Okay. So this slide is just a little bit of a closer look at the change in the average daily sales. So again, looking deeper at the declines that we saw in pre-rolls and topicals. Topicals I found interesting, and then just the growth percentages that we're seeing in edibles. So we're seeing, that there's been very different response rates based off these time periods. And so this particular time period, or the data that we're looking at here, is data that's pre-COVID, so January 1st through March 6th, and then through the COVID time period of March 7th to March 31st. And so across all of these markets that we're tracking at Headset, this data in particular is pulling in from California, Colorado, Washington, and Nevada. We saw that the average daily sales increased by 10% across the board. So this is giving us a really good baseline to compare each category against. But as we can see here, it's edibles, beverages, and flowers saw the most increases. Edibles clearly the outlier at 20%, 28% of an increase. And on the other end of the spectrum, pre-rolls and topicals really didn't seem to be as top of mind to customers. And this is probably, just implying that these weren't stock up items that would be necessary during the quarantine. So another thing that I thought would be really interesting to look at, and MJ Biz just did an article on this, but is really looking at the vape market, because the vape market over the last 12-month period has really experienced some challenges. And so from the vapey crisis beginning in the summertime and really starting to end or taper off around end of September, early October. And so, what we're looking at here is just these changes in sales from that time period. So all the states that Headset was looking at, so California, Colorado, Nevada, and Washington, we really saw that all of these states experienced some type of decline in vape sales, again, from that period in which it first started, which was around August 23rd. And then we saw that everything started to taper off. It started to stabilize towards the end of September, early October. And so now I think we're back to those normal growth rates that we were seeing. But one of the things that I was really curious about from both of your perspectives is, what you're seeing in terms of vape market sales. And in particular, Conrad, with you, I'm curious because I've heard from some retailers that they're actually advising customers to shy away from any inhalable items just to be more conscious of their lungs during this time. And so I'm curious if you have any insights on that. Is that some type of perspective that your sales staff would be providing to customers, or are you really kind of staying out of the giving advice in that, because we really don't know as an industry in terms of the health effects of vaping?
Yeah, agreed to that last point. Yeah, that starts to get real close to doctor's advice and that kind of stuff. So, we are continuing to have a lot of questions that come in, and our focus around educating the consumer is very important to us right now. But in terms of an individual's choice as to how they want to consume, there are so many different factors to take into consideration between their living situation, their own personal health, their own personal preferences. There's a lot of different factors there. So, for us, we're not giving any blanket recommendations as to the method of consumption for certain folks. And as of right now, in terms of vape sales, just in terms of the data, it's been holding steady. So there hasn't been a particular change in the underlying data.
Mm-hmm. Yeah, and I have heard, that from some manufacturers and some retailers, that because of the issues with the supply chain and a lot of the hardware coming from China, and some of the devices coming from China, that their businesses have been affected in terms of sales on that front, but it isn't necessarily because of any causation in terms of a consumer necessarily not wanting that product because of these health-related concerns.
Right.
Okay, cool. So the next thing that we thought would be really interesting to provide some perspective on is basket analysis and what people are purchasing during this time, and what demographics are purchasing. And so what we're looking at here, we can see that across all generations, the basket sizes, so meaning the total number of items that go into that purchase or in that cart, have increased significantly. And so this data is looking at 4 trailing weekends pre-COVID. And so we see here that Gen Z had the biggest increase in total sales. And it was also nearly identical to the increase in basket size that they saw. And so what was also interesting to us is that even though their total sales for baby boomers had decreased slightly, the average basket size had actually increased at more than 12%, which indicates that some of these, that this demographic wasn't necessarily prioritizing all of these stock ups. And so my question for both of you is, or actually, Chris, let's start with you, because I know you've done a lot of great analysis on generational basket analysis. And since we have both seen some really interesting trends in terms of females being larger purchasers during this time, at Headset, we've seen that both generations have seen increased spending, but we saw that females actually more than doubled the sales growth than males. And so this could be speculated that, females didn't have as much of these products stocked up on hand and they felt more of a sense of urgency to stock up. But I'm curious what you saw.
Yeah, really interesting. And I did a similar analysis again, just kind of looking at that delivery lens, trying to segment between storefront and delivery. And we definitely saw a massive increase from February to March in terms of delivery. We saw females up about 68%. So a significant increase in terms of their buying. So that was really interesting to see at the delivery, delivery realm. Additionally, I looked at a layered age over that as well to see what the average age was for a female doing delivery within our platform here. And average age was about 44. So that was about 4 years older than our typical average male that orders delivery. So I thought that was an interesting data point that we're seeing, but definitely a pretty big increase in terms of buying power from the female side, at least in our system.
And Conrad, have you noticed anything interesting, especially from the differences in stores? So perhaps Coachella Valley has a bit of a higher age demographic versus Oakland in particular, but is there anything interesting that you've seen in terms of demographic or male versus female trends?
Yeah, the Coachella Valley is interesting just because, this would be kind of our first, this would have been our first big kind of festival season out there, and even tourist season out there. And so obviously, as we all know, tourism is gone right now. And so, yeah, the Coachella Valley skews a little bit older than some of our other stores. But it's hard to know what normal is right now because we were planning for a pretty large kind of, Coachella Festival. Coachella Fest would have been happening. So that would have brought in a younger demographic. So we're not quite sure where the baseline is to measure from out there. But in terms of our other stores, for instance, the Santa Clara area in San Jose tends to skew more male and a little younger. Whereas Oakland, we do have that strong kind of female buying power. And, there's a lot of speculation on that as well in terms of, why is that happening? So, that's something we're keeping a lookout for because there's one thing to catch the trends in the data, and that's another to try and attempt to explain what's really happening, because that's how you can really start to make some decisions around that.
Mm-hmm. And once you do understand that, what would be some of those decisions that you would then make? Would you change like how you market to this consumer by store, or how should a retailer be thinking about those changes right now and trying to, continue to increase their sales?
Yeah, marketing is interesting right now because even before COVID-19, marketing was extremely limited for cannabis companies. Some of the largest marketing that even happened was billboards, and billboards are close to useless at this point. And then on top of that, we had, email or text campaigns, and those can quickly become an exhausted source because you're reaching the same folks over and over. So one of the key things that we would do, if we understood some of the data trends and what the behavior was behind it, would be really just talking about how do we talk to consumers, how do we present products to them even within the store, or what do we prioritize in terms of any of our marketing emails, right? So if we were to prioritize products that seem to be more attractive to a female customer set, right? Those are the kind of things that we might be looking at, right? And that's how we'd look at it. Interestingly, this COVID-19 thing is changing everything, right? How we market, who we talk to, and what products we sell. It's touching every aspect.
Yeah, and I would like to jump onto that. To a little bit here. I've seen a huge increase in terms of e-commerce, right? We had a lot of folks that were not necessarily taking e-commerce seriously, but it was a secondary method for them, right? They had a storefront that customers could go up to. That was their primary interaction point. And with COVID coming on, that's kind of flipped on its head. Sometimes you're seeing the website's the first interaction point. So we've seen a lot of people reconsider their e-commerce plays in terms of their digital presence and how people are consuming that. And I think that's a really interesting topic to look at. And I've been seeing some world-class e-commerce sites come out from some of our providers, it's really awesome to see. I think it's helpful for the user to understand and have that education content kind of coupled with the shopping experience.
Yeah, actually, so that brings us to a great point in which we were discussing earlier, Chris. So like thinking to the future, so, you know, post-COVID, what do you think will happen in terms of e-commerce and delivery? Is this something that is here to stay and that this is just going to continue to grow? Or will, you know, in-store be just as, you know, continue the growth and just the same, you know, trends that we're seeing now? Or are you thinking that this is going to be much more of a shift in terms of consumers being more used to ordering online and e-commerce?
Yeah, this is my personal opinion here. I think there's going to be a huge shift to stay with e-commerce and delivery. I think customers will understand the convenience of, one, the shopping experience, and two, actually getting that product. I think overall the storefronts will become kind of an education center. So for those that want to learn more about the brands, want to learn more about maybe certain ailments or something like that, you know, go into the store, understand a bit more about that, and have that kind of one-on-one. But I think people are going to kind of have that Amazon Prime type of kick in and say, hey, I need this tomorrow, or I need this today. And I think that's what we're going to see generally over the next, let's say, 2 to 3 quarters. I hope it stays that way. But that's what my prediction is, that delivery is going to be here to stay, and it's going to be a primary method. That hopefully, you know, with California being with California being on the forefront of delivery, I'm hoping other states will see that too and start to adopt these type of models, because we haven't seen a whole lot other than Colorado move on the delivery standpoint.
Yeah.
Yeah, many states don't yet support it. And Conrad, I don't know if you have any perspective on this, given all of your work on the policy side, but when we look at states like Washington that pre all this happening didn't support delivery, didn't have that as part of their market yet. There's many other states that yet don't. So I'm wondering, from a policy perspective, if this will be the change for all of these states moving forward or post-COVID.
Yeah, like I said earlier, that COVID-19 is kind of touching everything. It really is also touching this policy piece, and I'm very curious to see what happens on a number of policy fronts. So obviously this delivery piece. So even in a local jurisdiction that perhaps is not friendly toward the idea of delivery, they have to be thinking about it now, right? There's no way they're not thinking about it. And the question is, at what point will they actually then decide to flip the switch when the pressure is too much, right? And at some point they'll have to be like, well, people are not going to stop consuming cannabis. So you have to make it as convenient and safe as possible right now. And similarly, I'm thinking about, frankly, on the back end of all of this, which we all need to start thinking about as well, is the recession, right? Millions of people are losing their jobs. Folks have to make decisions about how they're going to spend money, whether they're buying food, paying rent, or purchasing cannabis, and those decisions have to be made. So that's the back end of all of this, is part 2 of the crisis, right? Is a recession. And I'm thinking about all those local jurisdictions, just from a California perspective, that have banned cannabis, but that in many ways their budget is dependent on retail revenue, retail sales revenue. And so you think about that and think about, will there be an effect? Will there be an acceleration of possible jurisdictions in California opening up? It's too soon to tell, mainly because what's driving all of this right now is the pandemic and then the health crisis. But when the recession crisis really comes into focus for folks, I'm very, very, very interested to see what happens in opening up delivery and opening up actual jurisdictions that have bans right now.
Yeah, and on this front, and from a policy perspective for California, do you think that, I know there's several proposals being worked on right now. Our biggest issue as an industry, I think that we hear across the board, is the challenges with high taxes. And so I'm wondering how policy potentially could change after this. Do you think that there will be some tax relief, having a decreased or completely removed cannabis or cultivation tax for the next 3 years? I know these are some of the discussions that are taking place. But how do you think that policymakers are going to help ease and help all parts of the supply chain essentially make more money to get through this recession?
Yeah, it's a good question. And to be really frank, your guess is as good as mine right now. So what's interesting is that there was a lot of pieces already that were moving prior to COVID-19. And what has become abundantly clear, and which is the right path, is that any legislation that's moving through, whether at the state level, local level, or the federal level, is going to be directly tied to COVID-19, just period. And that is, at this point, we can't even guess when the legislature will be even back in session, right? Because they can't even meet to get things done. And so the question is, if they have a very short timeline to even get things done, and they can barely even get together, they're going to prioritize those things that directly impact COVID-19 and then the recession, right? So those are going to be the main things. So the question there is, for the cannabis industry, excuse me, how would we prioritize what we might need as an industry, and prioritize how can we help, right? How can we as an industry help the state of California and any jurisdiction that we're in, both maintain jobs, keep tax revenue coming in, and help grow the economy once we get this recession, once this recession deepens, and also how can we help in general with COVID-19, right? How are we giving back to the communities? So that's really the way we need to be thinking about this stuff right now.
Yeah. I think that's a great point to kind of close it out and just recap on what we were hoping that we could provide to everyone here. So just to reiterate Conrad's point earlier, if you are a retailer, now is more important than ever to make sure that all of your all your procedures are as focused on the health and the care of your patients as possible. Also remember to get involved with your local municipality and have your voice heard, because again, our lawmakers and politicians do not come from cannabis. And so we really need to be vocal with everything that we're doing as an industry to make sure that this essential business is as safe for everyone as possible. We also want to start thinking about e-commerce, and as Chris is talking about, making sure that you have some plan for delivery if you do not support it, because most likely after COVID, this is still going to be a trend that we're going to see from consumers in California. So be prepared for this. And then, from my end, I hope that with all the data that Headset was providing, my goal is that everyone starts thinking more from a data-driven mindset. A lot of what I presented today probably seems pretty obvious, but it's always good that we're not just running off some gut instinct and that we can confirm what we're already thinking. And so hopefully some of these data points provided you that perspective. And then I wanted to close out with just a reminder about some of the resources that are all available to you all. As Justin mentioned earlier, CCIA has a great resources tab on their website, so you can get access to a lot of this real-time information. Headset on our website, there's a green bar at the top, and it's the link to our blog. On this blog, we are posting real-time updates every day from information that we're finding across the markets that we report on. And then Blaze did a webinar last week. So if you want more information as a retailer in terms of how do I prepare my business and get set up for delivery, Chris did a webinar on that, which you can go find on their website. And so, yeah, now we can open it up to some questions. So Justin, I don't know if there's any that you can send me in this chat box.
It looks like we got a few coming through, so we'll go ahead and run through those. If you don't see them, Jocelyn, I can definitely go ahead and read them out.
Okay, cool. So I see one right here. We assume that as a cannabis business, a testing lab, that we are not eligible for loans, payroll tax credits, etc., as these are federal. Do you have any info on this? Conrad, I don't know if you have any info on this. I do not from my end.
Yeah, that's a good question, and it's ongoing. I think the easy assumption, which is probably not wrong, is that any stimulus package coming out of the federal government would probably not be able to be applied to a cannabis company. So it's unfortunate in terms of that perspective. But it is worth speaking to a CPA or some lawyers to try and understand, is there a nuance there where there could be a part of your company perhaps that is maybe hemp or something like that, that maybe they could try and look at it. Now, we are working with the state of California as well, since if they provide some stimulus relief for companies, the state of California might be able to do something to provide relief to cannabis companies. It's TBD at the current time. So yeah, unfortunately right now the answer is most likely no.
Another question that we received from Bram Goodwin is, what about rolling out cannabis compassion programs, which became legal in 2020? Good PR and the right thing to do. Conrad, can you talk about from Harborside's perspective? I know you guys have been very vocal on compassion programs, and
Sure.
also just a link to the Last Prisoner Project and stuff like that. So it'd be great to hear how you guys think about this.
Yeah, the compassion program has been, at the heart of Harborside since the very beginning, in terms of making sure that folks have access, safe access to clean medicine, all the way from way back in the day, and the current regulations that kind of put a stop to all that work was really unfortunate. But if I recall correctly, I want to say that the new regulations for the compassionate program coming back in started March 1st, so the timing couldn't have been better. The question is, from an operational perspective, is thinking through creating a new program. How do we do it? Do we have the bandwidth, right? So that's part of the question for operators to think about, is spinning up a new program, and how do you run the program? But the answer is, yeah, we should absolutely be looking into compassionate giving right now, across all factors, across every sector of the economy, of the industry, right? So it is also compassionate giving. We should do it. And figure it out. One of the nice parts of the new regulations is that a cannabis company can contract with a third party to figure out compassionate giving. And that might be a way to ease some of the operational burden. So that's something to think about, and to seek out those partners to help you get it done. Another thing to think about as well is how you're giving back to your community that you're in. So in the same way that we're on the front line, so are other folks, right? We have healthcare workers that are on the front line, and we have folks even just working at grocery stores that are on the front line. And so those are the folks that we need to all support together as well. So looking to how we can raise money for those folks, and even if it's as simple as buying food for your local fire department on one of their shifts, right? It's that kind of giving right now that is all about being a good neighbor. And so it's important to focus on that right now.
Mm-hmm. Yeah, and I would also like to add, aside from the compassion programs, but in terms of the equity programs that we're seeing in California, I just want to echo, so I've been working closely with Oakland's equity program, which is run through Make Green Go. And one of the things that I've really learned in working with LaWanda over there is that the equity programs need all of us to get involved and contribute whatever skill set that you may have. So if you think that your business or you personally can provide some type of relief or some value to these programs, they're constantly looking for other people to contribute those skill sets. And so it's just, again, like another good reminder for us in this industry that we can do so much more together. So if you have something that you can provide, these programs are looking for that help. And so one of the really cool things that they're going to be rolling out, because Oakland is going to issue those 4 licenses at the end of May, is rolling out a marketplace. A lot of retailers in San Francisco, as well as Oakland, there is a requirement in which you have to carry a certain percentage of equity product on your shelves. And so LaWanda is going to be rolling out a marketplace to which retailers can go in and they can see what equity products are available and start to drive those conversations through that marketplace platform. I say all this because, again, like, it's really important that if you have something that you can provide, and if you believe in this fair and equitable industry, all of these people are looking for support. And so you can feel free to reach out to me, and I'm happy to make that introduction. I know Chris and from Blaze is also talking about supporting the equity programs with our point of sale system because it supports delivery and distribution. So please get involved, because they definitely could use the care in this time. I'm very concerned about every business in general, but particularly when we're going through a potential recession and we're having, all these challenges and the fallout from COVID, we really need to make sure that the equity businesses are supported as well, because these are the businesses that received the licenses last. So they're going to struggle just as much. So if you can get involved and provide some value, please do so. So with that said, I don't know if Conrad or Chris, if you have any closing remarks, but I think I could speak for all of us when we say that we're all available here as resources. Our emails are listed in this deck, so certainly feel free to reach out to us if you have any other questions. But I think that's where we leave you all.
Yeah, Thank you, Jocelyn. I'll just say briefly, thanks to you and Chris for helping get this webinar going. I think it's really critical. Obviously all of us are getting used to the idea of having to do events and meetings virtually. So thank you all for doing, a nice virtual meeting. And it's key if it wasn't clear, one of the themes that is emerging is engagement, right? It's engagement in your community. It's engagement with your local jurisdiction and your local elected folks. It's engagement with folks that are working on the social equity side of things. It's engagement with folks on the front line, right? The healthcare workers that are keeping us all safe and protected. So, and that engagement extends, right? It extends to the state level and it extends to trade associations like CCIA and others. And so working with those associations, being involved in those associations, because it's those associations that allow us to come together and have focused efforts and have focused priorities, right? And that's how you maintain cannabis as an essential designation, for one example, right? Let alone the other things, because guaranteed in this crisis, we've made it through a little bit of this initial panic, but the crisis is really still in the beginning phases. And the backside of this crisis will be a recession. So there's going to be a lot to work on. And so you have to maintain that engagement and keep it up. So I just want to say thank you to everybody. Yeah.
And Jocelyn, thank you, Conrad. Thank you. I've learned a lot from you, Conrad, specifically, and kind of what Harborside is doing. So thank you for being open and sharing that. And I would just say, similar to echoing what Conrad said, I mean, it's all about engagement, right? Part of some of the most innovative, some of the biggest innovations have happened in times of crisis. So we've been looking and really connecting with our retailers, with our distributors, with our cultivators, and saying, what can we do to help? And so we're flipping around the equation and asking, is there technology that we can build to make life a little bit easier? But at the end of the day, it's all around community, and just grateful to have the CCIA and partners like Headset and Harborside here. So thank you.
Mm-hmm. Yeah, and I just want to remind everyone, or let everyone know, the reason that this webinar came together in the first place, it's really just because we're trying to be active members. So if you feel, again, the same comment around social equity, if you feel you can provide more value to CCIA and you have something to share with the members, it is about this engagement. And that's the opportunity that CCIA is giving to everyone. It's the benefit of being involved in this association. It's that we have someone that is supporting the policy and fighting the policy that's best for us long term. But it's also to get involved in these types of opportunities. So they're here for you if you want to do blogs. Justin has stressed it, or any content, the webinars, they're here for you to do that, but it requires you getting involved to do that. So hopefully this is a good reminder to everyone that it's all possible and you can do this. So yes, thank you, CCIA, for all of your support. Much appreciated.
All right, everybody. Well, thank you for being a part of this webinar. And that wraps it up. Just to let everybody know, this will be available up on the website by tomorrow at the latest. So definitely check that out and check out our previous risk management and tax webinars as well. And then we have a suite of them coming up. So keep a tab on the CCIA website for all of this different content that's coming out. And just to echo what they are saying, there are numerous ways to get involved within the association and really have it be a mutual beneficial relationship. A lot of these webinars, a lot of our content really is bred out of our committees that is run by chairs who are members and people who are involved, or dozens of different members coming together to really hammer out these issues. So we don't claim to be experts. We really try to funnel the work that you guys are doing on the ground and really have that steer the association and our legislative priorities and educational content. So I thank everybody for being on the call today, and hopefully see everybody next week for our webinar next week. And thank you to the panelists.
Thank you.
Thank you.
Yeah. Bye, everybody.